As an employee of Continental, you're eligible for health insurance. We have two very different insurance plans, each meeting very specific needs. The purpose of this presentation is to explain each plan and how to enroll or waive coverage. At the end of this presentation, you will need to make your choices on each plan. However, you will have 30 days from your start date to make any change. To begin with, we want to make sure you are aware of the recent laws regarding the Affordable Care Act, or ACA. When you file your income taxes, you will need to verify that you've had medical insurance for at least 9 months of that tax year, or have an approval to be exempt from having to carry medical insurance. If you did not, you will be faced with a tax penalty. The first plan I would like to explain is our basic indemnity plan. This plan is not a qualifying medical plan. However, the plan has excellent coverage at low premiums. With the indemnity plan, you can get medical coverage. If you take the medical, you can also get dental, vision, short-term disability, and term life benefits. In addition, you can cover dependents at a slightly higher premium. But if you want the dental, vision, short-term disability, or life, you must take the medical. Let me explain how the benefits work. With medical, there is no copay and there is no deductible. There are network providers. However, with medical, you can go to any provider. The insurance will pay the same. When you see a medical provider, the insurance will pay a flat amount toward the bill, depending on what service you had. Under outpatient benefits, when you have a physician office visit, the plan will pay $100 towards the bill. For lab work, $75, and the amounts paid are shown in this section. With outpatient services, when the insurance has paid out $2,000 in medical claims, that portion of medical coverage is done for the year. On January 1st, it goes back to zero, and you have another $2,000 for the next calendar year. For prescriptions, the plan will pay $20 per day with a $600 annual limit. If you're hospitalized, the plan doesn't cover the entire bill. Again, it just pays specific amounts per day, but there's no annual limit. It will pay as long as necessary. If you take dental, there is a $50 annual deductible, and then the insurance will pay a percentage based upon the service being provided. For major services, there is a waiting period, the length of time you must have paid into the insurance before the plan will pay. But for exams and cleanings, there is no waiting period. With vision, I urge you make sure you're going to an in-network provider. The plan pays very well in-network. For an eye exam, you pay $10 and the insurance will pay the rest. For frames, the plan will pay $110, and for single vision lenses, you pay $25 and the plan will pay the rest. You can also get contact lenses if you choose. If a physician states you're not able to work due to an illness or injury, short-term disability is an income replacement of 60% of your salary up to $150 per week. This benefit will last until you're released to return to work or 6 months, whichever is sooner. Term life insurance provides a $10,000 policy on you, and you can elect dependent coverage if you choose. The premiums for each plan, including dependent coverage, is listed under each section on the enrollment form. But as you can see, complete coverage for employee only would be $19.98 for medical, $5.23 for dental, $2.35 for vision, 60 cents for life, and $4.20 for disability, for a total of $32.36 per week. These premiums will begin being deducted on about your third paycheck, and your insurance coverage will begin approximately 30 days after your start date. This explains the coverage of the indemnity plan, but remember, this plan does not satisfy the requirements to exempt you from the tax penalty. For that purpose, we offer a second choice called the Minimum Value Plan or MVP plan. If you enroll in this insurance plan and carry it for at least 9 months, you will not face any tax penalty. This plan offers excellent medical coverage with a hospitalization supplement available. Through the medical coverage, if you go to a physician for preventive service, the insurance will cover that bill at 100%. A list of the preventive services covered are listed in your enrollment packet. For treatment of an illness or injury, there is no deductible. There are copays for the different services provided, but as an example, when you go to your primary physician, you just pay $15 and the insurance will pay the rest. If you go to a specialist, your copay is $25 with the insurance paying the remainder of the bill. For prescriptions, there is a $15 copay for generic drugs, $25 for brand drugs, and $75 for non-preferred brand drugs. Unfortunately, there is no hospitalization included in this plan. However, you can enroll in this hospitalization supplement, which pays a benefit amount per day. But you must take the medical to enroll in this hospitalization supplement. These are the weekly premiums for the minimum value plan. For employee only, if you take the medical, it's $29.54 per week. Hospitalization, $5.68 per week, bringing the total weekly premium to $35.22. This plan will go into effect on the first of the month following 60 days of employment. Again, this plan does satisfy the requirements of the Affordable Care Act. You may choose to enroll in the indemnity plan, the minimum value plan, enroll in both plans, or you may choose to waive coverage of both. However, we need you to complete both forms today. You have 30 days from your start date to make any changes to the election you're making today. For the indemnity plan, please complete your personal information, make your election, and sign the bottom of the form. For the minimum value plan, complete your personal information, make your election, and sign the bottom of the form. Your premiums will be taken out of your paycheck pre-tax. You will not be paying taxes on these dollars. But after 30 days, you will not be able to make any changes unless you have a qualifying situation. For the indemnity plan, when your first premium comes out of your paycheck, the coverage will begin on the following Monday. The minimum value premiums will be taken out of your paycheck 1 month before your coverage begins. But when your employment ends, your coverage continues until the end of the following month. For example, if your last date with Continental is March 15th, your coverage of the minimum value plan will continue until April 30th. As a reminder, you have 30 days from your hire date to make any changes to the election choices you make today.